Aloha, welcome back. It's Chandler Rose, and I have Abby here. We're doing massage for knee pain related to injury or the impact from a car accident. So I have her supine laying on her back. I have her knees elevated. I like to always make sure that the feet are in alignment with the hip joint and not cinched together. You'll see that a lot, especially for first time massage people. Their feet will be so close together, and I think that's okay. The way I say it is separate your ankles, have them be hip width apart. That sort of railroad track position, a gentle kind of bend in the ankle will help the hips and the knee. That sort of balance from head to toe, that connection, just allowing things to feel natural. So I like to start by taking a slow, deep breath. One hand on each knee. Sometimes with knee injury or surgery, you'll see scars. Sometimes you'll feel extra heat on one side of the body. With the legs, it's kind of like the arms. You have a dominant side. Typically a right-handed person will have a right dominant leg, but not always. Sometimes you have the other way, depending on their job, how they're standing. Some really lovely massage butter that I made, I'm using again. Big part of my work is working with these plants. I feel like they're helpers, and I like the help because this is very physical work, and it can be sensitive receiving as well. So having the slip and the moisturizer and the plant extracts can be really good for pain sensation. We're using chamomile, also an amazing tea to drink for sleep. We're using blue tansy, which is one of my favorite flower oils. It's actually blue when you use it in its natural form. It's a blue oil. It's kind of cool, especially with kids. They're always interested in the color of things. So I'm going to start on the side that I'm working on. And I can tell that she has a little tension on the lateral side of this knee. You have the quads coming in, you have the connections, and then you have the IT band, the fascial layer. Specifically, fascia is the case of the muscle. So you have this sensation from the tension in the muscle, and then you have the nerve sensation that comes from the case or the outside covering. If you're a cook and you work with chicken or any sort of animal protein, you might notice the fascia is that white, dense layer. So when you work on the fascia, it's good to note that it's more tender and nervy than the rest of the muscle. Just taking my forearm, gliding through. Just taking my forearm and gliding through. Anterior leg, the top of the leg, versus posterior, where the hamstrings are, can be often more tender than the other side. How is my pressure? So good to check in on pressure. I like to ask, do you want more or less? Sometimes people, if they don't know you especially, they might not communicate if they want more or less, and then finish their session and wish that they had communicated that. So yeah, definitely communicate when you need an adjustment in pressure, because this is your session. And if you're learning, be comfortable knowing that you don't know it all and you don't know exactly how it feels. A lot of times new therapists get so comfortable that they just kind of take this stance where they do what they feel like is right. But work together on that pressure. So you have the quads, and you have these bands, the lateral side of the knee here. It's a nice place to do a little cross fiber frictioning. Cross fiber is going across the striations of the tissue and just blipping over that muscle and going back and forth, kind of like guitar strings. They can feel like that. They can also feel super, super tender, so maybe you just want to do a little holding there. They might feel super tender, so you might just want to sink your fingers in and do a little breath, holding, waiting for that tissue to relax, change. You have the lateral quad, which is on the far side. You have the IT bands in here, and I'm just dragging my fingers over, which usually is enough pressure to make a difference. Less is more in the fascial tissues. I remember learning this work and having it be having it worked on my own IT bands and thinking, I don't think this is how it's supposed to feel, because it was so tender, and I just thought, well, that's not relaxing. So I'm sweeping around the knee, doing a little lomi stroke here, which is Hawaiian for weaving. Have my forearm at an angle. This is called the tool in lomi practice. And then I switch to the other side and do a little lengthening above the knee. The quads are one place where people ask for less pressure. So start slow. Pause, breathe. Ask questions. If they're asleep, it's probably not too much pressure. I think it's a compliment when people fall asleep, but at the same time, I've had clients that will be upset about it because they miss out on the experience and they want that experience. So everyone's different. If you're seeing someone one time and it's relaxation, and like in Hawaii, I get a lot of visitors that maybe come once a year, then they might not want to do this deep structural work. They just want to zen out. That's cool, you know? It's like you're supporting them in a meditation place, and sometimes they fall asleep. I think that's wonderful. But I have clients that are like, wake me up if I fall asleep, which isn't really your job, but just, you know, kind of go with the flow on it. Sometimes the best part of receiving a massage is getting a break from everything else. You're allowing yourself to get a break from all your family obligations and your work obligations. I find that taking a break and getting this kind of work, especially if you're adapting with an injury, will allow us to show up in a way that is more kind and loving to our families and the people that we meet along the way. Coming back to a little, you have the kneecap here, the patella is that bone. Then you have the connections above it, which can be really tender tight. So I'm going to do a little faster petrissage here, which is a Swedish technique. It means warming or kneading. Kind of similar to Lomi, but Lomi uses the forearms or the tool. Swedish is pretty much just using the hands. So give your hands a break. This is a really amazing, easy technique to learn, even if that's the only stroke you know of Lomi. It's just, so easy to just go right there. And you can follow it all the way up the leg and back down again. Tracing the path of those muscle lines. And just coming back to a couple points in the foot. And I'll come over and do this on the other side. All right, working on the left leg, left side of the body. I'm kind of angled in towards Abby. You may want to stand directly on the side to do some of this work, but this is just so you can get a better view of the knee. So going back over, you have these bands that run on the side of the leg. Really good to roll them out if you're familiar with a foam roller. There's also tons of foam roller videos if you're interested in that. It's a great treatment for knee pain as long as you're not in this very injured place. You want to do it when your body is healed up and ready for that kind of fascial work. It's a good way to do some self-care, some self-massage with the foam roller. You don't get the oils, but you get the fascial release of the IT bands with the foam roller. Super good for the knees. So doing some slow Swedish effleurage, which is palmar pressure. Going into that Lomi stroke, you can use both arms. Get inventive with what portion of your arm you're using, as long as your wrists and hands are happy and you know how to regulate your pressure. I don't recommend going straight in with the elbow. That is a technique that might be useful in certain places, but it's definitely one that I hear people complain about. Like, I don't like the elbow work, but I don't hear people complain about the forearm. I think it's because it's this spread out even pressure. Kind of feels like Swedish, but you're closer to the person than you are with Swedish. So in some ways that may feel more comfortable. In some ways it might be a little more intimate. So I would look up Lomi if you want to learn more of those specific techniques. I also teach some Lomi as well, something we do in Hawaii. In every session we integrate Lomi. So anytime you're going up towards the heart with the muscle fibers, you are stretching and lengthening, like yoga or ballet. You're stretching and lengthening, creating more space. Now make sure you breathe. Anterior quads, the quadriceps. These big, bulky, strong muscles that make up the upper leg. They are kind of like a shield. They protect our leg and our bones. They are helpful for running and kicking and walking and all the bending we have to do. And most of the time, when people's quads are tight, they don't feel them pain-wise. However, when you have a knee injury, sometimes you do feel how tight they are. Taking my thumbs along the top of the knee, around the patella, sometimes under the patella, which is the kneecap, is what a lot of people say. And then doing a little fascial stretch here. I'm gonna brace the knee with one side, take my palm into the IT area, breathing. You can stop if you feel something more dense, more resistance. If you're asking your therapist when you get a massage, can you feel that? Most likely they can, because we do it all the time, so we can feel. It's kind of like washing dishes. Can you feel it when there's something stuck on the dish? You feel it. You don't even have to see it. You can kind of feel that stuckness, right? Similar with working on the body. When people are in pain, it tends to feel kind of like that, like crunchy or congested or just different than the mushy, healthy, malleable, movable muscles. So you can take any specific area and do these lengthening pressure strokes with the thumbs. You want to check in about pressure. Is that too much pressure? And you can stop if you feel a little trigger point, if they are feeling a sensation referring down or up, anywhere in the body. Maybe you'll hear about that, and I would stop and take a breath. The last thing I want to mention before we end this portion of this video is that this is a great area to self-massage. Just yesterday, I was sitting on my bed, I was talking to a friend, and my quads were super tight. And I had my little oil next to me, and I just went in around my own knee and I did this work, and it's a place where you can reach it. I mean, it's a very convenient area to work on. So if you have a knee injury, especially if it's something with impact in the front, I would suggest you massage your own knee every day, even if it's 5 minutes. Take your oils, give your body a little length, a little self-care. Make sure you drink a lot of water, especially if you're receiving this work from someone else. You really want to rehydrate. And it's so helpful, and you can find your own depth of pressure, and then maybe you receive a massage and you're more open because you've had your own thumbs in there working on those really tender points. So try it out. I'm sure there's so many videos on self-massage for knee injury as well. There's lots that you can do on your own, outside of a physical therapist, outside of a surgeon or a doctor. There's so much knowledge right in your own hands, in your own body. I'm just gonna take it a little down into the foot, kind of ground out on the knee. I like to touch in on the foot with the other hand, just acknowledging that we are a whole person with all these amazing networks that work together. We all have specific stuff going on, and we all have the ability to come back to the heart and take a breath, send out really good positive vibes. I'm always grateful for every person I get to work with, because I learn. Everyone has their unique stuff, flexibility and history. Thank you so much. I hope you learned something, and I hope your knees are feeling great and more flexible. And I look forward to seeing you very soon. Thank you.
If you enjoy these videos, please join us at PsycheTruthPatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit PsycheTruthPatrons.com.